So do we have any apologies for this evening, please, Esther?
I've received apologies from Councillor Harrison and Councillor Collins, and I believe Councillor Virgo will be joining us a bit late for the meeting. Rebecca Willans is also potentially running a bit late, but she will be joining us.
Thank you. And does anyone have any declarations of interest, please?
None.
No.
Thank you. And has everyone seen the minutes of the last meeting? And anyone need any changes? Everyone happy with them?
Yeah, happy with them. No changes needed.
Thank you. Right, well, thank you to the team from Berkshire Healthcare Trust. As you know, we've been looking into the sexual health within the borough. And we've put together, obviously, if you'd like to show your presentation, and then we've got some questions for you, if you don't mind.
Yeah, sure.
Thank you.
I'll start. I'll just take my camera off whilst I'm sharing. So just bear with me. Okay, can everyone see that?
Yeah, thank you. Should we do some introductions, who we are, just for information before we start the presentation, or you want us to do later?
No, please, that'd be brilliant if you'd love to introduce yourselves. I do apologise.
Raza, if you want to take the presentation down for a minute, then we'll introduce ourselves, then we can start the presentation. Thank you.
Yeah, sure. Yeah, my name's Raza Ahmed. I'm the service manager for Sexual Health Service.
Sunita, do you want to go next?
Hello, everyone. I'm Sunita. I'm lead nurse for Sexual Health Service as well.
June, do you want to go next?
Sure. Good evening. I'm June Carmichael. I'm the Associate Director for Contracting and Service Development for the Trust.
Good evening, everyone. My name is Srini Lagiri. I'm the Service Director for Scheduled Care for Berkshire Healthcare. What do you rather?
Okay, shall I start?
Yes, please.
Yep. So Sexual Health Service is provided by Berkshire Healthcare Trust across East Berkshire from multiple locations, including Bracknell. Okay, Bracknell Sexual Health Service provides Skimpert Hill, Monday 10 till 6 o'clock, Bracknell and Wokingham College, Tuesday 11:30 till 1:30, which is a walk-in clinic for young persons clinic. Bracken Walk Youth Hub, which is a walk-in clinic on Tuesday 3 till 5 o'clock. Skimpert Hill again Thursday 10 till 3, and then Skimpert Hill Thursday at 3 till 6 o'clock is a walk-in clinic for young people. This Bracknell service is a walk-in service as well. Welcome patients as walk-ins. We offer online appointments where patients can book coil and implants, and symptomatic appointments where patients who have symptoms, they can book appointments, and we have asymptomatic clinics as well for online. Asymptomatic is where patients don't have symptoms or underlying issues. They can order online STI kits, which are sexual transmitted infection kits online through Safe Sex Berkshire website. If the kits aren't available, they can go into asymptomatic clinics where they can be seen by a clinician. Phone lines are managed Monday to Friday. Young People's Clinic, just to reiterate, this is the 13 and plus of age group. And what do we offer? Services offered in Bracknell. STI testing, this is asymptomatic where patients don't have any symptoms, and that's offered at Bracknell. Emergency hormonal contraception, condoms, contraceptive pills, long-acting reversible contraception, pregnancy testing, uncomplicated STI treatment, symptomatic patients are seen here as well. If it's complicated symptomatic treatment or complex care, this is referred to SLOW, which is our level 3 service. Health promotion is provided through our Safe Sex Berkshire website. For example, educational videos, leaflets, any social media that is done via Berkshire Healthcare Network through our social media team. So the overview of the service currently, where are we at the minute? The service has made significant progress in key areas so far that enables the service to do more transformation work to improve access, feedback, and patient care. We have automated patient feedback, which is I Want Great Care, where patients can leave feedback via, they'll get an SMS. If they're visually impaired or with disabilities, they can get a paper copy from the clinic to leave feedback. And this is fed back to the patient feedback for data set to monitor and improve the service. Bookings, online bookings, due to pre-COVID, when COVID hit, we were one of the services where patients could book online and get their sort of virtual appointment and book online as well to see a clinician. Online testing, which is available now through Safe Sex Berkshire website, where they can order the kit, get that delivered at home and send that back and they'll get their results. We have health promotion, which we've done through social media via TikTok, Facebook, Instagram, to get educational messages through there, which what I mean by that is the Sexual Health Week, the AIDS Week, and just to get the message across to our patients. Psychosexual therapy and GP referral pathway, that's embedded with the GP services where they can send referrals to sexual health services through their system via sexual health service. Automated pathology results, this is where service users can get results via text message. The negative, if it's positive, then the pathway for that is managed by our healthcare assistants for aftercare. Service improvements and developments, the 4 key areas or themes that we're in is digital, efficiency, outreach, and optimizing care. The work streams, the first work stream is digital. Digital is self-care, where STI testing kits for underserved population. We're looking at deprivation codes. We're looking at age groups, part of that digital journey to make improvements and revise that digital pathway for what we've got currently. Direct messaging, this is where patients can contact a clinician directly. This is part of work stream 1, where patients can contact clinicians directly. Work stream 2, efficiency, digital pickup of medication. This is reducing unnecessary clinical time and allowing people to pick up their medication up without an appointment where clinical appropriate. Automating insight, where we can look at our data, get a bit more digital with our data to help us explore our performance and identify efficiencies. And promoting sexual health, where we will develop objectives and outcome measures. Outreach, where we want to work with the sex workers and health inequalities and asylum seekers and people with disabilities Currently, we've got project in flight in regards to delivering and working with asylum seekers around the locality, part of the Gilead project, where we're working closely with hotels and GP services to improve access to sexual health services. Workstream 4 is optimizing care, where we're building a data-focused mindset, cross-training our staff, patient forum. We need to ensure that our services are providing the best care and experience for patients. Once all our initiatives are implemented, the service will better empower people to take control of their care through digital innovations, operates in a streamlined, data-informed way, delivers the right level of care at the right places, and delivers for the whole community. Thank you. Any questions?
Thank you. Look, brilliant presentation. Well done, Raza. I'd like to congratulate you on that and say what a brilliant job the team are already doing. May I just ask a question? When you say that you're sending the tier 3 go over to town, over to Slough, what percentage is that? How many have to leave Bracknell to go to choose the facility at Slough for that reason alone?
Yeah. So it's not a percentage. It's if it's complicated, where we can't, where they referred back to level 3, where we've got a level 3 service at Slough.
So what would that be for?
So that's your complicated GUM, complicated, you know, if they've got, if they can't be seen at a level 2 at Bracknell, is directed towards level 3, which is at Slough.
Thank
Just
you.
sorry, Caroline. Sunita, you might be able to explain a bit more clinically what the difference between level 2 and 3, if that helps, Caroline.
Thank you.
Sure. Hi. Yes, so level 2 is where we're treating uncomplicated STIs. So I'll just use a very simple example, and please do let me know if I need to clarify further. So if we have a woman who just, you know, attends with a vaginal discharge but doesn't have any lower abdominal pain, anything like that, then that's something that we can see in Bracknell because that's uncomplicated. But complicated if they have any abdominal pain, if they're pregnant, they have genital sores and other physical symptoms, then they fall under level 3. So those are the patients. But however, if there's something we can do for that patient there on the day, we'll still do it because, you know, if we think there's some antibiotics, we can start them and then follow them up in Slough, we'd still do it because at the end of the day, patient care and, you know, their comfort is more important than anything else. But if, you know, they solely fall outside the remit of level 2, then they get referred. But then again, what we do, we contact Slough as a clinician and give them a date and time to come to Slough when we know that those patients are expected and they're seen there and then. So it could be, you know, on a very day, depends on what the patient would, you know, prefer. So yeah, so that's arrangement that we make ourselves.
Thank you. Councillor Welsh?
Hi, thank you for that presentation. I just had some questions around what you're planning to do digitally. As you say, you want to have more direct messaging. Is there any plans to update your website at all?
Yeah, so just coming back to the digital journey, part of the Safe Sex Berkshire and the online STI, that is part of that work stream. So we're looking at that, how we can streamline that, make that a lot easier for our patients. There is a piece of work that we're working with our sort of Marcoms team, digital team, in regards to get some educational videos in regards to that, and that is in the pipeline.
And do you have a timescale on that to be completed?
Yeah, so it's going to be around 1st of July we're looking at, and we have regular meetings with our commissioners in regards to that, where we are with that. But yeah, we are on track in delivering that.
Thank you.
Can I come in just to clarify a couple of things? While we're doing some digital work in the trust and some videos and education side of it, if my understanding is correct, Safe Sex Berkshire website is not Berkshire Healthcare website. So just wanted to clarify that point. Where we can do from a Berkshire Healthcare, we will try and do it. But some things we need to work with the commissioners, and that website is not Berkshire Healthcare. Just to clarify, thank you.
Great, thank you.
Thank you. Councillor Virgo.
Thank you, Caroline. Got a few questions, actually, if I may ask them. There are, in the figures that I've been given from Bracknell anyway, there are nearly 900 people that are now referred from Bracknell to Slough. So my first question is, it isn't a small number. This is a huge number, actually. But just before we get to that point, could someone tell me, are we paid? Do we have to pay as a council for the people that are referred to Slough? Is there an extra payment beyond the contract, please?
You want me to come in there?
Yeah, please, yeah, June.
No, so the way that we're commissioned determines where patients go. So because we don't have a full level 3 service in Bracknell, we relocate the people to Slough, but we're working within the financial envelope within the contract.
Okay, so we don't
anything more than the contract.
So basically, the answer is no. We don't pay that. Okay. Then my second question would lead on to that. I mean, I've been to both outfits, actually, both to Bracknell and Slough, and I met Raza, and he was very kind to help me, and I've met Jan at the Bracknell clinic. Now, I had to be candid with you, okay? Clearly, it's chalk and cheese. Bracknell looks like a very poor cousin to a very affluent uncle, if I may put it that way. Now, what I don't understand in the system, because I haven't read all the conditions of Tier 1 and Tier 3, but clearly Bracknell needs more help. I mean, anyone can see that a mile off. It's not coping with the demand. That's absolutely true and borne out by people. Now, if we decided to...
Oh dear.
I haven't hexed him. I haven't deliberately frozen him. Honest.
You might want
We'll
to put his
till-
camera off. That might help his bandwidth a bit.
Yeah, we will wait for Tony to come back. But on those points that he was raising, obviously, next year, there's going to be, where you're currently located in Bracknell, it's going to be change, isn't it? Because the new building.
Yes.
So have you got any influence in that to basically what Tony was saying with regard to making it just more welcoming? Because I know it's the building itself, it's not you, it's literally when you go into Skimphead Hill, it is old. And it, you know, it hasn't got any signage outside, it isn't welcoming for people going to the garden clinic. But would you be able to have an input in, have they asked you with regard to that moving forward as a clinical department who's going to be using that building?
I'm happy to respond on this one. We're working with the ICBs and we're working with the primary care because of the part of the next door development. It's going to be called, I think, Bracknell Health for so Bracknell Health Centre, I think. We are working with the ICB. Some of the BHFT services will be part of that new provision from the building side of it. And some of the things we are exploring is what is possible in terms of should be the clinical aspect of should be delivering from the new build part of it. And there will be some services within the existing building, which is Skimphead Hill side of it. But we can look at that side of it when it comes closer to that one and see what is possible. But at this point in time, there is BHFT is working with the partners to influence that.
Excellent. How's that influencing going? Because one of the things Councillor Virgo noticed, we sort of sent him he was supposed to be on a secret mission, but either way, he did notice that obviously there was no signage going in, and then you had to, if you weren't quite sure, you had to ask a lady at a desk, and then it was difficult to navigate. And we're just hoping for the new building.
Can I take that over? Sorry,
yeah.
The IT is obviously.
I'll just wait. I was ad-libbing till you came back, Tony.
Thank you. Yeah, I mean, putting up a sign, it doesn't take 10 minutes, frankly, but it isn't. So that's the first thing. But going back, I mean, I'm more interested in the health, actually, to be honest. You know, it obviously needs a lot more help in Bracknell. There's no one, I think, that would argue with this. If we decided to put a doctor there and increase the outreach, not the outreach, but the nurses, how could we achieve that? Would we have to renegotiate the contract? Could we, you know, put an additional amendment to the contract? How would you suggest? Because I think anyone that understands this and goes there needs more help in Bracknell. It's a growing town. You know, at the moment, the standards, the supply is not worth the town. It isn't. And that's not to say the staff are brilliant. Of course they are. I've met them. They're terrific. But they can't do what they can't do. You know, it's impossible. So how do we move this forward? Who would like to answer that one?
June, would you like to come back on that one, please?
Yeah, and my colleagues can come in too. I think the first thing that we would say is that the contract can be varied. You can make a change to that contract just by raising a variation. I suppose you've got two ways of looking at it. If you're financially challenged and the money is the money, so the money that's in for Bracknell is all you can afford, then one thing you can do is change what we deliver for that money. So you might change the emphasis on getting your Bracknell population under the level 3 better seen in Bracknell and stop doing something else. That's one way you could do it. It's probably not the ideal story. Or we would have to look at what resource would be needed to deliver the level 3 within Bracknell and present
and I suppose
if
I may just interrupt you there, June, a sec. I suppose what I'm saying is, if you look at Slough and you look at Bracknell, I mean, in Slough there's an HIV clinic which is brilliant, obviously brilliant for a reason, clearly, but it's brilliant. We're nowhere near that, of course, but if rather than go to the full amount of Slough, because I'm thinking of money as well, could we not go halfway house and say, right, what we'll do is, I mean, Caroline's already mentioned there'll be a new building. The building's terrible, to be honest. Let's be honest. It's shocking. But putting that aside, could we increase it with a doctor outside the contract and make it like a tier 2 plus contract and an extra nurse, and then you could bill us if you have those staff, of course. I don't know. Maybe you don't even have the staff. I'm not sure.
I mean, that's kind of what I was saying in my second point. You know, you can increase the resource, and by resource I mean whether it's a doctor or the right clinical level in Bracknell to attend to those more complex cases. And just, I think you know this already, I'm sure you know this already, but the HIV clinic that's in Slough is actually commissioned by NHS England to serve the whole of the east of Berkshire. It just happens to be next to the Garden Clinic, or part of the Garden Clinic. So I would say we could quite easily come back to you with a proposal if you wanted to have a tier 2.5 or a tier 3 service. What would that look like, and what would it need to deliver, and cost that up for you? We could do that relatively quickly, and then it's about choices you make.
But I don't want to stick to the. I mean, I'm saying so I'm the commissioner, which I'm not. But I don't want to stick to, you know, tier 3 has to have this and has to have that and has to. I mean, I'm guided by the clinicians. I'm guided by Raz. I'm guided by other people. To increase the service clinically, a doctor and an extra nurse would make a hell of a difference to that system.
And we could cost that up for you.
Yeah. Okay. That would be brilliant. Thank you.
And what I don't know is whether we've got the resource that could work.
Well, that's my second question.
New people in.
Yeah.
But we can look at that. So if I'm hearing you, we need to cost up for a doctor and a nurse.
Yeah, I'd just be interested, if that's with your permission, Caroline, to see what that cost would be.
I think, it would be interesting to look into it. I also think, though, that the most important thing is from the service providers, they can honestly tell us if that's what is needed in Bracknell, if they've got those people going to them that they have to pass on, that they feel that we could be dealing with within the borough. Because they're the ones with the numbers.
I gather that
They're
was
the
true
ones-
though, Raz, isn't it? I mean, we had this conversation between you and you said to me, to be fair, that a doctor and an extra nurse or two would make a world of difference to Bracknell, which, because it's not coping with the demand. And to be absolutely, I want to be candid about this, to send 900 people from Bracknell to Slough with the really poor public services we have, you know, in terms of transport, is just not acceptable.
Councillor Welch.
Sorry, yeah, no, I completely agree with what Caroline's saying. We need to know exactly the figures. We need to know the data. I agree with you, Tony. If it's needed, yes, absolutely. You know, we should look at it, but we need to know the data first, and we need to have that.
I agree, but where I slightly disagree is that, I mean, I'm not making this up. I mean, I'm not saying Tony knows more than the clinicians. This has come from listening to clinicians and understanding what they're seeing on the ground. And I think that needs to be looked at straight away. We can't have a town that is in a rather poor provision for sexual health. We just can't, you know, and someone has got to thump this door to get this done.
I do think, though, what we have to remember is we started this and we spoke to Bex about what was really sort of, if there were and was anything we could look into, and that was the fact that we had a lower testing rate in chlamydia, and we also had slightly, you know, later diagnosis of HIV. If we managed to get people going forward a lot earlier, which is our goal, would the clinic be able to cope with that extra demand unless we did something? It's all right saying to a service, we would like to see this, this and this. We want the numbers improved on this, and saying to the residents, get along, get tested. But if the facility would then struggle, that makes it a whole different different ball game. And it's up really as well to the facility to sort of say to us, well, yeah, we would love to do that, and you send you know, extra people to us so we can hit these figures. But
I mean, I got the
we just
feeling,
haven't got the capacity to deal with them.
What Caroline is saying, I got the feeling when I went to Bracknell that they felt like they were locked up in a small room, almost with the lights off, and no one knew about their service. I mean, that's what I got the feeling, and that may not be all true, but it certainly looked like that when I went there, because first of all, I couldn't find it. I mean, that's a fact. There's no signs. And secondly, they're in a cupboard. I mean, honestly, this is not acceptable. Now, I'm not blaming the commissioners, I'm not blaming Berkshire Health, but all I'm saying is we have got to improve this service, and we can't wait for 3 years to do it.
Yeah, but we have the new building that will be in place.
Yeah, but we don't have the staff, Caroline, at the moment, because we're a tier 2, and that's not going to change.
Okay, June, did you want to say something?
Yeah, I think one of the things that's really important, so, you know, we would agree that data, it only tells you half the story. So if you're getting complex cases going from Bracknell to Slough, we will have that data and we will know how many it is. That would allow you then to judge whether you need to have full-time people in the clinic, or whether you could do it 2 or 3 days a week and still improve the service of Bracknell. And I think, and my clinical colleagues will say, it's not necessarily about freeing up capacity by improving some other elements. The determination of what staff we bring in to take this up to a different level is based on skill set rather than freeing up capacity.
Absolutely.
So
Agreed.
I think the data is really important, and we can look at that to see how many it is. We could then, when we do the costing, we could advise you that we think we might be able to do that on 2 or 3 days a week rather than 5. When you go down to that granulation, though, recruiting people on 2 or 3 days a week is much harder than recruiting people on a 5-day a week. So we could look at that. But I think I think the message we're hearing is clear. I think it's one that we've talked about before, and I think you know, Caroline, thank you for your support in terms of the building. We all know that there's parts of Bracknell that have been needing updated for many years. We were in Fitzwilliam House for years, and we moved out about a year ago. So you know, we know that the building is not fit for purpose, and we know that we need to have something better. But I think if we go away off this call and think about what is the number of people we're trying to prevent going to Slough, because we know the transport infrastructure is not good enough, then we could then come back to you with some kind of proposal, and we could do that fairly quickly. We're not talking about taking weeks to do that.
That's great.
Thank you.
That's great.
Caroline,
Yes.
Just
Yes.
jump in before you say anything. The other thing is, I mean, things can be improved straight away. I mean, on the website, and I misunderstood this. I thought this was Bracknell's website. There's absolutely no reference to the gay community, the LGBT community at all. And that's something we could change now. We could do it tomorrow if someone worked on it, you know, and it would make it more presentable to those people. I mean, I agree with June, and I'm pleased June said this, because statistics will only tell you half the story. You know, a lot of people that can't get what they get from Bracknell will go to Ealing, or they go to, you know, somewhere else. I mean, it's absolutely right, because they feel that they've got to do it in a very discreet way. So let's listen to the clinicians on the ground who are doing it, and listen to the people, and they know what's going on there. Because when I was there, 3 people turned up and didn't have appointments. They just turned up, and that was just in an hour in Bracknell. So, you know, I'm sorry to keep on about this, but I feel passionate about this now. We have got to improve this service, and that's it.
Okay.
Sorry,
Right.
Caroline. I've gone
That's
off on
all
one,
right.
actually.
No worries. If you'd like to
yeah,
come
I'll
in there.
come in. Yeah, just a couple of things in relation to signage. We have already logged a call. Okay, so with the signage kind of area, we are working with our estates team to improve the signage side of it. Again, it's within the factors we can try and do that one. Again, absolutely agree. We need to develop the services, what is appropriate for the local population requirements around it. But we do have our own constraints with the workforce skills and the money and the finance and the commissioning side of it. But if we got more flexibility, if we got more resources, Berkshire Healthcare will do everything to enable that improvements to happen in Bracknell. Thank you.
Thank you. Councillor Welch.
Yes, just to actually highlight something Councillor Virgo said about, which is that they feel that it's not known that they're there and nobody knows about it. That's why I was asking about your digital offer at the beginning, when that would be done by, because we all picked up on parts of the website we believe could be improved. For example, the walking clinic, it wasn't very obvious. You have to go halfway down the page to see that that's there. Also, the times of your phone lines, it said throughout the week on your website, and then you phone and it tells you it's Monday to Friday. So we thought that could be better defined on your website. I mean, if you get all of these aspects really, you know, done well on your website, I think it will encourage a lot more people to go there.
And also sort of commenting on what Councillor Welch has said, when I saw your slides, I didn't know you went to Bracken Walk, because when you go onto like the garden clinic, it just talks about the garden clinic.
Yeah.
And I didn't know how that was like shared to anybody, unless those young people were actually physically going into the youth club and finding out. But I didn't know how that was then, you know, is that advertised through schools? Because if it's not on the website and that's the one that you're directed to, how do the young people find out about that one?
Yeah, just before Bex comes in, currently, Caroline, it's done through newsletters at the schools and the notice boards in regards to that, and there's sort of social media team in regards to that. We have got other social media team who are working on that, and that should be in place by end of this month. In regards to the website, we'll take that away and we'll talk to Bracknell Forest in regard to that.
Thank you. Bex?
Okay.
Hi there, can you hear me okay?
I can. Thank
Perfect. I'm
you.
in my car on the way back from a
Oh,
focus
bless
group.
you.
Haven't been off having fun. Well, it was good fun, but anyway, I was just coming in to clarify about the website situation. So I've put in the chat, I don't think it's come through, to clarify. Yes, Safe Sex Berkshire is a website that the councils in Berkshire manage, and the commissioners in Berkshire East are working with the commissioners in Berkshire West to review that site. The reasons being that we've done some analysis, I think it's called user generated analysis. So if you remember the public looking for an STI test kit or advice or contraception, what sorts of things come up on Google searches, what sorts of things come up on smartphones, and also with young people locally who've been looking at their feedback from focus groups. And the overwhelming sort of findings really have been that Safe Sex Berkshire is hidden. So it unless you know that Safe Sex Berkshire exists as a website, you don't find it. It doesn't come up even in the top 10 Google searches, and we'd have to do a lot. We'd have to invest a lot of comms work to kind of change that. But also for younger people, as I reported last time, actually anything with sex in the title, that it might be blocked on their smartphones, or they wouldn't want it on their search history. The second thing is that the NHS brand is really strong. I mean, that comes from national surveys, our local focus groups with younger people, and also that's what's most prominent. So NHS Choices, which you can go online and you can search for any site, and that's where you'll get the full list of all the local sexual health services, depending on what you need. So the scope of the review we're doing with Berkshire West commissioners is, do we still need a local website? Or is that just adding another layer of unhelpful complexity? Or do we make sure that the NHS sites that are available are really good quality, including the NHS Choices one, that we can make sure the content is up to date on? And if we do have a local website, just scoping what resources needed. So it doesn't cost necessarily that much to set up a website. It's the investment in the communications teams that go behind making sure the content's up to date, is useful, is being promoted. So all the things being discussed here. So the time frame for the scope of that review, the Safe Sex Berkshire website, the contract with the current web providers due to end of March next year. So there will be something up and running well before then, but we're still negotiating with the Berkshire West commissioners precisely the timeframes for that review. But it is in the next sort of 6 months or so that the analysis and the kind of options appraisal will be complete on that work. So I just wanted to clarify that difference between the Berkshire Healthcare Foundation Trust website, Safe Sex Berkshire, and the NHS Choices websites.
Thank you, Bex. Can I just ask, you might have mentioned this, and I do apologise if you have. So when a young person, if they go on their school's website, is the information on there as well?
So
Could it be?
So it could be. So I think there could be work with schools locally to ask them to unblock that website. I think you can specifically add certain sites as safe sites.
Because all I'm thinking of is, like you said, for a young person at home, they can't like type in the word sex, they get blocked, they don't want mum and dad to see it. But if they've literally just gone into their school website and it's got listing on there the opening times, etc., or where they could go, they're not even putting those words in. It's just something, if anyone was looking, they could say, right, I was just checking something about school, I just wanted to, and no one knows any different. They're just on that school website. And I thought it might be quite a nice safe place where they could look that's not going to get blocked by them. And also it's something then, it's only going to be a time or date that the school might have to amend, because really that's more or less set in stone when those opening times are. I just wondered if something like that could be done as another form of,
I think that's a really important point, and I think that is something that could be actioned much more quickly than the full review of the website, just to kind of look at, is there some web content, be it a web page that we could make available to schools, just so that within their own sites they could host something. We have to be careful with obviously once information's out there, it needs updating, So I think that's something I could pick up with colleagues in BHFT and think, how can we safely signpost the schools to a source that we're happy is going to be kept up to date in terms of clinic times and telephone numbers, because that is part of the problem at the moment with Safe Sex Berkshire as well. If something changes in BHFT, we have to follow through to the information on Safe Sex Berkshire, and obviously if we miss that, even if it's for a couple of days, it can mean we're spreading, there's misinformation out there in terms of that, clinic times, etc. But that's something we would definitely follow up on quicker than the review's finished, to make sure there's accurate information out there and accessible to young people.
Thank you very much, Bex. Councillor Cochrane.
Hi everyone. It suddenly occurred to me, I'm backtracking actually to the signage. I believe Skimpard Hill is owned by Property Services. It is, isn't it? I believe. Well, couldn't they be responsible for the signage? Because I know they're doing it at Great Hollands Health Centre.
What we are going to do, or what we have done, is we've logged our call because of a BHFT service, but we do work with NHS Properties to make those improvements. So it is a channel we have to use it through our estates, but it's the property services. Yeah.
Okay, thank you.
Has anyone got any further questions or points they'd like to raise?
Sorry, Carolyn, can I, one other thing actually, would it be possible for June to come back to the committee with those costings, and also maybe a précis from your team of what you think would better Bracknell? Because I mean, I'm throwing all these things out, but I mean, the team must know really what would make this situation better. And of course, I've just come off a climate change committee. So, you know, the one thing they'd say is, well, we don't want people keep going to Slough. I mean, why are we doing this? You know, so it's all, so I think it's working together, isn't it?
Yeah, so I think what we would do under Shree's leadership, he would work with his clinical team to work out what would be needed to give you the enhancements that you're looking for. We would then work with finance colleagues to cost that up, and then I could send you something formal. So that's kind of the governance loop that we would go through. We would have to talk to finance colleagues, and look, we can turn this around. I don't know, Shree, a couple of weeks.
That's fantastic if you can do that. That's brilliant. Brilliant. Thank you.
Thank you. So once again, thank you to all the Berkshire team.
Thanks very much.
It's been lovely to meet you, and
thank you.
Hopefully we can make this really positive. When the new building is there, I'm going to personally have Tony with a bottle of wine against the sign doing open.
We'll put the champagne.
I think champagne, actually. For goodness sake.
But you know what I would say, Caroline, is we would encourage these conversations to keep going. If you've got any questions at all, just shoot them over to Shree and the team, and we're happy to answer any questions you've got in the future.
And thanks for the team. Thanks for the team, because they're doing some sterling work. So
they do a great job for the community.
Certainly are. And thank you for joining us, and enjoy the rest of your evening.
Pleasure. Thank you very much.
Thank you. Have a lovely evening. Bye.
Thank you.
Thank you. Thank you. Bye-bye, everyone. Bye.
Hello. Yes, Bex.
Councillor Eggleston, would you like me to stay for the latter half of the latter section of the meeting? I'm happy to, or I can drop off, whatever you prefer.
You can get out of your car now, Bex.
I'm halfway between Slough and where I live, so I will continue my journey. But look forward to any other questions that might come out between now and I appreciate next week's the recommendations. But anything else that comes to mind, obviously Esther said go through her, and I'll be happy to help. Lovely.
Lovely. Thank you.
Thank you all. Bye-bye.
Bye. Has anyone else got anything?
Everyone's dropped off,
haven't they?
Yeah, everyone. Well, apart from Sophie. Sophie's still.
I'm still here.
Sophie heard what you
knew, didn't you? You knew you had to stay. I was politely letting the others go.
Yeah, so fine. I'm used to working in this environment with people being asked to leave whilst you sit there silently waiting.
Yeah, that's it. You're just thinking. So just to basically sort of sum up, that was really helpful, I think. And if we can work with them, and a lot of the things that we are putting forward aren't of any cost to the council, and if they are, it's only to improve the service. It's if it's needed, which is what we want as recommendations, I'm absolutely sure. So what the plan is, next week it's in person. We will be discussing the recommendations and voting on them. So therefore it's got to be in person. If, of course, the most important thing is all agreeing, and also the wording on everything. So if anyone has any thoughts beforehand or wants to run anything past us, I think that's a good point, because sometimes when you're in that environment of a room and you're all face to face, sometimes it can be, oh, do I really want to say that? Is that a recommendation? So, you know, anyone who feels like they just want to sort of, yes, Cherise.
I was just going to say, I would suggest, you know, any recommendation, even if you feel it might be a bit rough around the edges, you know, put it in, and then we will look at it, and if we need to tweak it, I mean, mine will probably be a bit rough, for example, and then it might need tweaking on the wording.
Yeah, absolutely perfect. I think from what we've had, we're not going to be able to get another survey done in time from the other young people, and it would really have to be done. But then that's a recommendation in itself, that we've looked at the schools ones. Can we have a survey done by whoever is best placed to do that survey, to make sure that what they say they're doing, they are doing, and if there's any improvements the young people feel that should be made regarding what they receive in school, is once again a recommendation. The fact that we've mentioned about this new build, we're not asking anyone to do anything tomorrow, but this contract comes up for renewal again in 2026. So basically, Councillor Wright will be looking at it from the middle of next year. So it gives her then plenty of time for all this feedback to come back, a new building to be opened. And anything that then it's, even if we don't get the data back in time of how long, how many people are really using it, if we know there is a need, we can recommend she looks at that need due to the changes and, you know, more people living in the borough, so many going over there. It's up to her as a recommendation to look at that and say what we need by talking to them and looking at different contracts that might match our new town. So anything like that, don't think we've got to go and do it. We're just putting it forward.
I'm just going to put a word in for those of us who are in the outer reaches of the borough to say it's not just the town. We have Sandhurst and Crowthorne down at the southern part, which very often gets overlooked compared to the town itself.
Yeah, absolutely. And if you're that side as well, Slough is a lot further than it is from this side.
And I don't think the public transport to get there, if you're a young person without access to a vehicle and you're trying to get somewhere, perhaps without having to have the conversation with your parents and looking at some of the opening hours for some of the things, thinking, you're going to struggle to do that one without having a difficult conversation.
Exactly. And it's, I mean, if you knew, and I mean, I didn't realise they were at the youth club. That was something I thought they just did. But if I was a young person I knew, and I knew I couldn't sort of get out, if I could say to my parents, I'm going to the youth club tonight, they would never know any difference. No. And the parents, of course, would encourage, oh, you're going to the youth club, that's good.
Of course, yeah. But then it's advertising all of that, isn't it? Which is why, I mean, it shouldn't cost a fortune to change their digital offer and what people can see straight away, you know, to what is there.
I mean, I haven't sort of checked. I don't know if you have, Cherise, on the Bracken Youth Club. Does it advertise that they're there? Because if you're looking at a youth club, You would have thought that you would, or what's on
Mm.
tonight at the youth club.
I don't know. You'd have to, yeah, check if they do advertise it. And if
Because-
they don't, why not?
Well, exactly. You know, it is getting over this stigma as well, that and it's just something that, you know, it's just part of, we have this here on this day as a normal activity,
I
just
think
as normal as anything else.
I think even if the building wasn't, you know, being completely revamped, and if they weren't already kind of looking at their digital offer and what they can improve on, I still think there's a lot of recommendations we can put forward that shouldn't cost any money or cost a fortune, you know, compared to what Tony is suggesting with going up a level on the service, which will cost money without,
Which will, and
we don't know
might
how
need
much,
it.
but
I mean, as the town grows and we receive
might,
more
yeah.
money per head, that might be a way going forward. But at this moment in time, we know the council hasn't got any money. Anything that we can pass over to the service providers or Public Health England, because it's their responsibility, we have to. But our goal is at this moment in time to ensure, if nothing else, it's communication to the young people. It's making sure, obviously, that, you know, if they could add it to the website, if you've just got Googled Garth Hill, your mum and dad don't know what you're looking at, and your search history says Garth Hill. No more, no less. It's just, to me, it's quite basic things, really, that you'd think of. How would a young person then deal with this?
Yeah, and having it on the schools, all the schools' websites would be for everybody in the borough, for example, all areas of the borough, and, you know, not just the town.
Exactly, because that would go on to Edgebarrow, every school with the age pupils and every college facility should have that. And also we found out last
I think you
week,
have to assume that it has to go on to any school's website that's got children of secondary age or above,
yes,
regardless of whether they've specifically got a sixth form college, because
yes,
people who are technically underage particularly need
oh,
to have
absolutely.
a
Absolutely.
Well, they're
I
the
mean,
ones you need to get to the most, let's be
Yeah,
honest
exactly.
about it. Yeah.
they need to know where to go, and
it'll be the ones that will be most concerned about asking.
yes, because theoretically they've done something wrong in their eyes, and that they're worried, they're scared, they don't want anyone to find out. So even going into where that location is, if their mum and dad, you know, are patients of Forest Health or Evergreen, there's always a chance of a neighbour or whatever else spotting them. They're not going to be in the youth club. So, I mean, it's highlighting all of that, which even we didn't know about. But also, I think it comes down to every time we've asked for the data from them. I know that it says it's circumstances as well, but when you're putting forward any money proposals, it's going to come down to the data. How many people actually, I mean, we say, you know, 800 odd are being sent over there. If we moved up to a tier 2+, then how many would we still send over that we still haven't got the facilities to be able to deal with that? So that would be something else. So our recommendation could be that the executive looks into what the possibility, what that could look like to save our residents having to go there. Don't remember, we're not trying to solve this, but we're trying to put enough evidence forward that that's what should be looked at. And if extra money needs to then be added, at the end of the day, Public Health England give them the money to run that service. And it would be up to the executive to talk to Public Health England and say, we now need this, not down to us at all. It's just the recommendations that we're putting, which I think we've got quite a few. And I don't think that any of them are, that they're not stupid by having signage, by having leaflets. to me, it's. I'm sure, as you're all thinking, it is
I don't
basic
think anything
stuff.
particularly costly either. So
No,
No, exactly. There's probably loads we can put across before, I would say, it's kind of last resort to suggest we need to pay more and move up a tier. And it would be interesting to see what the actual data is. But then you could have the argument that if people don't know it's there, the data is going to be pretty skewed data, isn't it? Because people aren't going there in the first place.
yeah, well, but the thing is, though, that if you're asking for anything extra, and the whole brief was, people aren't, we've got lower detection rates of chlamydia, so we want more testing. We've got a late rate of HIV diagnosis. So the whole point really of it is, like, if they had all those extra people going through the door, could they cope? Because we don't want them to send another 200-300 over to Slough just because they can't cope with what we're sending them. But then that's not for us to worry. It's, once again, that would be part of whoever negotiates the contract on that, to say. And it's also they would then, I would like to think BHFT would then talk and say, right, okay, we're now struggling because these councillors did this. We've now got extra people coming in because they realise we're here and we're offering this fantastic service and we can't cope with it. So it's looking at the whole thing. Jerry, anything you'd like to add? She's gone. She's there.
still up.
Hi, Jerry. You're eating. We caught you out, didn't we?
And you're sorry, you're still muted, Jerry.
That's right. She's
Sorry.
trying to she's trying to finish her mouthful.
Desperately trying to swallow.
I've got a lovely husband who came in. He's cooked me dinner. So I thought, rather than sort of log off, I'll turn my camera. I didn't want you to see me eating, but I am listening.
That's right. Mine came in, sang to the dog, and luckily I was muted.
No, the only thing that I probably would have liked to have put in, and I probably put it in some sort of recommendation, was that my role last week or a couple of weeks ago was to look at pharmacies, and I probably would have liked to have said how much influenced, or do they have any say in, do they communicate with the pharmacies about providing emergency contraception? I don't know how much is that sort of done alone by the pharmacies, or do they actually liaise with the Garden Clinic or the Berkshire Healthcare Trust? I mean, how does it work? Are they standalone and just get funding for the contraception, or do they work with them? Does that all come out the package? Do you know?
I think they're sort of more standalone. And
I thought that.
That's it. But like you suggested, though, last week, that was a perfect recommendation, that not all of, we've got town centre again, like Sophie rightly said, that it's not all, we haven't got many chemists in Crowthorne, Sandhurst offering that service. Great Superdrug Boots, etc. Bulbrook.
Yeah,
I mean, fantastic. But what about that? It's not just the town centre.
It wasn't even all the pharmacies around the town.
No,
either.
there's very few.
Yeah,
there's very few, and I mean, obviously the Garden Clinic isn't open all week. It's like Teresa said, you have to ring, and the out of hours number isn't always picked up. And if you're living close to a pharmacy, if you're feeling that you need to get urgent help, that's the obvious place to go. So because it's local, you don't have to travel anywhere. Obviously, the clinic provides sexual health advice. So if you've got infections or whatever, you probably need to go to a clinic. But just drugs to end an unwanted pregnancy, it's all that someone needs. And if you're being looked after by a pharmacist and make sure that it's safe, then that's all that you probably need, really. And the pharmacies are open much more. They're open longer.
And they're open.
You've got the 9 till 6 and Saturdays. But obviously, if they're not, if they're standalone, how do you encourage them to offer that service? How do we do that?
I think that perhaps the executive team could talk to the pharmacist to open that offer up to
Mhm.
make sure there is one within such distance from each area.
Mm.
I mean, because Crowthorne definitely needs one, Sandhurst definitely needs one. So that could be a good recommendation. And also the fact that themselves, I mean, it's very much at the moment within the NHS pharmacy first. And most people are thinking, yeah, but what should I go there for?
Mhm.
So
Yeah.
it would be really nice, even if it was something simple, that it was a standalone web page. Perhaps we could add on to the
Yeah.
BFC website that says this.
Yeah.
These are the pharmacies that offer this, this, and this.
Yeah.
And if you've
I'm
got
going
it
to add
on
that
like
to
a
my
web page,
recommendation for the website page.
Yeah. But the
Sorry?
other thing,
you
yeah,
add that to your recommendation.
the other thing is I noticed when they did the first, I think it was the first or second slide, and it had places that young people could access to get help. And I noticed Bracknell College was on there. Now I've actually contacted, I'm still waiting for a reply from our student services, who are not always on our site. They tend to do multi-sites, because I wanted to see what advice they had, whether there was a leaflet or advice or what sort of document we have regarding sexual health. So when I get that, I will present that to see what they're offering and see whether it's similar or the same as what the schools sixth forms are offering. It'd be interesting. They actually are having a weekly session, which I didn't know about, which means it's not obviously being, I mean, I walk around the college all the time and I'm not seeing it. So, so you know what I mean?
Perhaps
They're in a side room. Nobody knows.
Yeah, well, that's it. That's exactly what we just said, though,
Yeah.
about the youth club. It just makes you wonder, are they, is it perhaps not so busy being used there at the garden clinic because they're already getting what they need from the youth club and also the college? We don't know, because that's not advertised. And do those in the college and those other children, did they actually know that they're there?
No, exactly. Yeah.
Because isn't there no signs up in the college then, Jerry?
Well, there are, but I mean, I must be honest with you. Maybe I'm not consciously looking, but I have had a look out this week, because I mean, now that I realise there's one every Tuesday, I'm going to have to see where they're advertising it.
I was going to say, you in tomorrow, Joey?
Yeah, I'm in tomorrow. Yeah,
You're
I'm in every day.
First thing, aren't you?
But but the thing is, I used to be downstairs, where it was the hub of everything going on, because we were with admissions and student services, so we were all in together. So I was much more aware of what student services were offering. I know they offered free condoms. They used to give them in envelopes to people, but now we're all in different areas. It's the more, you don't actually have the conversations with people to find out what's going on. So, but I will chase up. I mean, I'll chase up that she hasn't answered my email, and I'm sure she will once, but I might just say, can you just send me what you've got and tell me where you're signposting this information?
Because they should be on some notice board, I would have thought.
Yeah, they do have to. They have digital ones, so where they offer things. So maybe I've just not been aware of it, but I need to have a look. But there's certainly nothing in the reception area.
No,
So
and also
they
find
do have
out.
they have anti-smoking. They used to have anti-smoking. I mean, they have something in the middle of the college. We've got like a big cafe area. It's open plan. Not going to have a table with different things as you go in. But I haven't seen anything sexual health wise. But I will find out. I'll find out.
If it is still going, on the Tuesday, and it's not that obvious to you, and you walk in there,
no.
I think we should be highlighting this.
Yeah, well, I mean, maybe I just walk around with my eyes closed, but I don't think I do, because I am aware of cake stands and, all the different things and, all that sort of thing. So I would have thought something as important as that should be obvious.
Exactly. And could you also, if you do your sort of secret squirrel bit in there, Jerry, if you could sort of find out what they actually offer.
I will. I'll just ask Kelly. I'll just say to her, you need to tell me what you're offering, and she'll tell me. Because I mean, I have access to, students. I sort of work with students that need access arrangements, and I know I have access to EHCPs and things, so they won't have any problem. If we have a problem, a kid that's not doing so well, they will tell us what's going on so that we can help them out with their exams and things. So I tend to know quite a lot about what's going on, you know. So
Yeah,
yeah,
absolutely.
yeah. So
Thanks, Jerry. And Cherise, do you know, because obviously you've got the Ways Youth Club that we're working a lot with at the moment.
yeah.
And I should imagine they deal with older children as well.
Yeah.
Is
I
there
don't-
any service, or do the Ways point them to the other youth club?
I don't know, but I will find out. I'll ask.
Because that would just be interesting when we put our I mean, I think the whole thing around this has been very, very much about fantastic service going on, but no one really
No one
knows
knows.
how to
Get
that it's A, there, or B, how to find out if it's there. And
Yeah.
it-
I mean, I was just looking to see what there actually is emergency contraception wise down in this is one of these odd things. I live in Sandhurst, but my children don't go to school in Sandhurst, and I am not a counsellor for Sandhurst at a borough at the borough level. So I haven't really looked into what's going on down here, but just looking to see what there actually is down here. And it appears that there is a drop-in at Sandhurst School at Sandhurst Youth Centre that is providing emergency contraception. But what else are they signposting?
Yeah.
So I will try to find out a bit more about that from one of the councillors that does have responsibilities down in this area. And knows a bit more about it.
Probably
everyone else this week.
we should try and we should find out about Crowthorne as well, if they've got the same type of.
Well, again, one of the chemists there is listed on the NHS website as providing emergency contraception, and it's right on the high street. So most of the kids that go to Edgebarrow would have access to walking past it on a regular enough basis.
Yeah.
Okay, and then the question is then, if you've only. Well, I suppose at least if you've got a chemist in Crowthorne, Sandhurst,
and there is also, I mean, there is
centre.
a chemist as well in Owlsmore. Again, within probably that'll be about 3 minutes walking distance of the Sandhurst School, as well as the youth centre drop-in. So,
I mean, even it sounds like you can get help in the town centre. And you can get some help, obviously, in Crowthorne and Sandhurst, but it would be
I'd just like to know if they're signposted to actually to the clinics, because that's only the emergency contraception part of it. How are they actually being signposted to anything else?
Exactly, because if they're asking for emergency contraception, the answer is there really. They've had unprotected sex.
Yeah.
And everything else that then goes along with it. And are they being asked those questions really of like, you know, do you feel, or do you know about this? If you need it, here it is.
Yeah.
But then if it's that there should, I still do think that you know, okay, they're going to improve what they've got, but it'd just be really nice if the schools could have it on there as well as a complete
package.
A complete package.
One other question. As you're saying, obviously, it's kind of separated for the pharmacies. Is it possible to get the data on how many people of a certain age are coming in for the emergency contraception, or is that something we couldn't even get? Because it'd be interesting, wouldn't it, to see if it's a big number, then we are failing, aren't we? Because essentially they should have the information on safe sex, and hopefully that would cut through and it would be less of a number going in for emergency contraception.
I don't know, because do pharmacists collect that kind of data?
I would literally be,
I don't know.
Yeah.
Just to add another point, talking about pharmacies, when you walk into one, they offer you so many services now. They have things about leaflets on blood pressure checks, diabetes, all these, you know, things that you can get early intervention for. And when I went into Superdrug to find out about emergency contraception, the pharmacist came up to me and she said, "Do you want your blood pressure checked?" And I said, "Well, no, it's fine." And she said, "Well, we can offer a service." And I'm walking away and thinking about it now. There's nothing about sexual health or STDs. I mean, there should be a leaflet in. I don't know
Mm.
whether there are again, but I mean that's important, really. There's no reason why they shouldn't have leaflets with that. There's no reason why every pharmacist, even if they can't offer anything, they could at least have information about where to go, but they don't.
Yeah, I
They
fully agree. I
probably
think
should.
when this new building opens, I think it almost, at the moment, has been stated, no fault of their own, it's hidden away. It's almost like, oh,
Yeah.
you know, you're sneaking in, like, and sneaking back out. If it's just treated as something that is as normal as anything else, and it's just the service that is being offered by the NHS and its providers, then once that's normalised, and it should be the same with leaflets in chemists, etc. It's nothing to be embarrassed about. It's just.
I've got
Yeah, but
one
it shows a
question.
stigma there, doesn't it? It shows it's still stigmatized because they don't
Well,
have
it
those
is
leaflets.
exactly. So imagine how that feels, and they're not showing anything. And that's for heterosexual couples.
Yeah.
If there's any diversity to that, imagine how they feel without being able to get any information whatsoever, because it's hidden away. It's almost, and that's
That
what I
makes
would
them
like
want to
not
hide
to
away,
see.
doesn't it? That makes them want to hide away because they don't. Yeah, if it was just there and commonplace, they wouldn't feel embarrassed. But because it's not there, access, they feel. Yeah.
I just
I
had a
would
question
love.
about the leaflets. Do we really feel we should be pushing leaflets? Because, I mean, younger people probably would just prefer a poster with a QR code now. I mean, it's all very, you know, is this bad for the environment? It costs money to print leaflets in the first place.
Yeah, the only thing is, I'm just thinking that some people, we've got to think of absolutely everybody. Some young people don't have phones. There's got to be, like they said, when they do their feedback, people can fill a form in online or they can collect a paper copy. So I think it doesn't mean they're going to have loads of paper copies, but we still got to be able to offer that. And I hope as part of our Pride event that we're having this year, I would love the garden clinic to come down and be part
completely.
of that.
Yeah, I like it.
I mean, once again, I know that isn't necessarily that, well, it is really, it could be a recommendation because we've got this facility and then it gives people a chance to go up and ask any questions.
Yeah.
Because it will be
100%.
more young. If everyone, you know, that's something I would be recommending.
Yeah, I would.
Because we're going to have stalls and that there. So once again, it just makes it more open, more normal. You know, they walk away. Or did you speak to so-and-so from the garden clinic?
Hopefully there's a space left because it's not far off, is it, Pride?
We will find a space.
Okay.
Because I think it's important, and I think it'd be really nice for them to get their message across in a really positive way as well.
Yeah, I completely agree. I hope that we can do that 100%.
That'd be really good, I think.
Highlights exactly what the offer is for people who were not aware of what is there.
And who wouldn't perhaps feel that is this service for me? I don't really want to go in and ask because it's just something.
Even at the minimum, you know, they could be giving out condoms to people, that type of thing on the day.
Yeah, it could be something. I mean, that's something that could be whoever, I mean, as it's being organised, it's like the executives could perhaps look at, and then it could show our commitment as well to what we've been looking at. Yeah. And also gives them a chance to promote themselves, have a list, tell them it is at the youth centre, tell them, you know,
where to go
and have the list of everywhere. Be really, really good, because everyone from the borough at some point hopefully will call into that event as well.
Yeah, you'll get a mix of people at that event as well, like last year.
Yeah, exactly. And that also gives even if somebody isn't from the area but has travelled and thinking, I didn't want to go in my own area, but they've got this service, that's brilliant.
Yes.
Well,
I
thank
do
you ever so much.
apologise. I'm going to have to drop off.
Yeah,
to go and
absolutely. I wanted to
collect
apologise
child.
for going over. And I
fine.
look forward to seeing everyone face to face.
What time next week?
It's 6:30.
6:30. Okay.
Yeah,
6:30.
the